Hello, this is Alina doing room room 360. My patient Liana. It is 7:26 and head to toe. All right, I have gathered and cleansed all of my equipment, and I'm not doing a 1-minute brain dump. Okay. Knock, knock. I have provided privacy for you. Hello, my name is Alina. I'm going to be your student nurse today. I'm going to provide hand hygiene. Can I get your full name and date of birth?
Liana Hansen, January 15, 2003.
Perfect. I'm going to double check with your wristband. Yeah. Oh. Perfect. Can I do you have any allergies?
Animal dander.
Perfect. That won't interfere with our assessment today. No PPE is needed for this assessment. You can use PPE in the future. I'm going to look at the provider's orders. It looks like we have a head to toe assessment. Provider's orders back. So we're gonna be inspecting, asking questions, feeling for abnormalities, and then testing your musculoskeletal system. Do you have any questions before we begin?
No.
Perfect. Gathered and cleansed. I'm gonna ask you 3 questions. Have you had any appetite changes?
No.
Do you have any history of eczema?
No.
And do you need any aids for walking?
No.
Perfect. So before we begin the assessment, you already said you don't need any aids for walking. Do you need any hearing aids or you have your glasses on, so that's fine. Do you need a pee at all? And do you have any hearing aids that you need?
No and no.
Perfect. All right. Are you in a comfortable position?
Yes.
And do you have any concerns?
No.
Awesome. We're going to start with vitals. So we're going to do temperature. I'm going to do the ear. All right, 99.8. I'm going to go ahead and write that as soon as this turns off. 99.8 Fahrenheit. I'm gonna start blood pressure. Oh, and this is my card. This is for temperature that I just got and the card. Scooch over to forward blood pressure. I'm gonna do the 2 steps. So I'm gonna start with the 1 and then pressure number. Relax the hand. Okay. The first step was at 110, so I'll go 30 above that, so 140. So 140 for the next step. I did temperature, I'll do pulse and respirations. So on this one, I'll do your pulse. All right, so respirations were at 18. And then pulse was at 64. I'm gonna go ahead and get that second blood pressure. The second step of blood pressure. Okay. Got 100/68. Okay. With normal blood pressure is less than 120 systolic, less than 120 systolic, less than 80 diastolic. Elevated is 120 to 129 systolic, and then 80 or less diastolic. Stage 1 is 130 to 139 systolic, and 80 to 89 diastolic. Stage 2 is 140 or higher, and then systolic, and then diastolic would be 90 or higher. And then hypertensive crisis is 180 or higher systolic and 120 or higher diastolic. And her range was normal, 120/68. Okay, so I got temps, pulse, respirations, all the vitals. I'm gonna go ahead and get your level of consciousness. So can I get your name one more time?
Liana Hansen.
Where are you at?
Ulrich Hall.
Perfect. And then do you know the date?
November 9th, 2004.
Perfect.
24.
Oh, you're good. And do you know why you're here today?
A head-to-toe assessment.
Perfect. All right, so level of consciousness, you are alert and orientated. We'll come back because there's two more or one more level of consciousness, vitals. Oh, your behavior. You chuckled and laughed. You're very happy. Your posture. You are upright, sitting upright. Let me just palpate your spine here. Checking for any signs of lordosis, kyphosis, or scoliosis. Scoliosis being the S shape of your spine, lordosis being curving inward, most common in pregnant ladies, and kyphosis, the spine is curving outward like a hunchback. You have none of those, it's all normal. And like I said, your behavior, content, happy, and whatnot, so you're good. We're gonna go on to skin. I'm going to inspect your skin for any lesions, bruises, bumps, anything like that. Checking for edema. So when you're checking for edema, or let's say I found a lesion, I would check for the asymmetry, border, color of it, and diameter, and then if it's elevated. So that's the mnemonic for if you found a lesion. The edema scale is trace being minimal depression. +1 would be 2 millimeter depression with rapid return. +1 or +2 would be 4 millimeter depression with 10 to 15 return. +1, +2, +3 would be 6 millimeter depression with 1 to 2 minute return, and then +4 would be 8mm depression with persistent indentation of 2 to 3 minutes. So also looking for edema. I'm going to go ahead, since I've inspected, I'm going to go ahead and palpate, looking for trigger, texture, any bruising. I'm going to see what I can see. Would you be able to take out your socks for me?
Yeah.
I'm going to be looking for capillary refill of the fingers and the toes. Perfect. Go ahead. Capillary refill is perfect. There's no signs of clubbing of the nails. Perfect. All right, and rapid return of the capillary refill. All good. Not too smelly.
My toes are a little clammy.
Oh, you're fine. All right. Okay, so that is that. While I have your feet exposed, I'm going to do the neurological Babinski test. So I'm going to swipe my hand under my finger under, just ticklish, but no spreading of the toes. So that is still a negative sign for Babinski. The Babinski test. And then I think that's all for the skin. Is good, I palpated. All right, so we're gonna go onto your head, starting with your head and go down. I am going to palpate. Oh, you can see. Do you want to move up a little bit?
I can't reach the ground.
Okay, now that we're done with the blood pressure, so I'm inspecting for asymmetry, any lumps or abnormalities, no foreign objects or anything. Hygiene is good. So now I'm going to palpate. Let me know if you feel any tenderness or hurting. Any tenderness there?
Nope.
Perfect. And then no signs again of lesions, bumps, masses, bulging, anything like that. So that's with the head. We're gonna go on to the eyes. So I'm going to inspect. The pupils are asymmetrical, so same shape and diameter on both. The sclera look clear, not clear, white and whatnot. Would you mind taking off your glasses? I'm gonna have you close your eyes. Let me know if you feel any tenderness on the bulbs. Any tenderness?
No.
Perfect. And then I'm gonna have you actually pull your lids down. I'm gonna look at the conjunctiva. Perfect. Good. It is pink and moist. So you're good there. I'm gonna go ahead and do the indirect and direct light. So indirect light, normal light, you look fine. I'm gonna go ahead and have you look forward, and then pupil dilated perfectly with each light. I'm gonna have you look, but not read yet. I'm gonna check for accommodation. Perfect. And then nearsighted, can you read that?
Have a great day.
Perfect. All right, and now I'm gonna have you look at this with only your eyes, not moving your head. 6 cardinal, 3, 4, 5, 6. Perfect. All right, so that's the eyes. We're gonna go on to ears. I have my otoscope here, and I do have my phone here just so that you can see the otoscope, what the otoscope can see. Well, first I'm going to inspect the outside of each ear. No drainage, serum, bleeding, or any foreign objects from the naked eye on both sides. I'm gonna go ahead and palpate. Let me know if you have any tenderness. The pinna, tragus, and then the mastoid process. Any tenderness there?
Nope.
Perfect. And then pinna, tragus, and then mastoid process. Any tenderness?
Nope.
Perfect. All right, now we're gonna go ahead and look in.
I put my glasses back on.
Oh, yes, yes. Right here, you can see right ear. And so for an adult, you would lift up and back. And then for a child under 3, you would lift down and back. So up and back, and you can see, oh, it's not working. Right. Okay. Just so there's no signs of anything, I'm just gonna do it. So you would look in, and then you would see any you would look for any drainage, discharge of serum, any for any of that. You would look for intact, look to see if the tympanic membrane is intact, which I'm assuming it would be. And then you would look on both ears. All right. So that's done. Turn that thing off. Let's see. Eyes, ears. We're gonna go on to nose. Just looking at your nose from the outside, I don't see any drainage, discharge, no bleeding. Would you mind lifting your nose up? Okay, no drainage, bleeding, no deviated septum, no polyps or anything like that. I'm gonna go ahead and palpate. Let me know if you have any tenderness.
Tenderness.
Perfect. So that's eyes, ears, nose, now mouth. Looking on the outside, oh, with the nose, I'm gonna look at the frontal and maxillary sinuses. So frontal, any tenderness, and then the maxillary. Any tenderness?
Nope.
Perfect. Okay, mouth. Looking at the mouth, it seems normal, and then looking at your lips, I don't see any abnormalities. They're normal per weather, pink, and whatnot. Would you be able to open your mouth for me? Okay. All right, moist. Buccal mucosa is moist. Would you be able to stick out your tongue? All right, and normal. Would you be able to say ah for me? Ah. Perfect. Uvula moved perfectly. I did see a lack of tonsils. Did you have a tonsillectomy?
Yes.
Perfect. All right. I'm gonna have you pull your lips down so I can look at your gums. Perfect. Pink and moist and up. Pink and moist. And would you be able to lift up your tongue so I can look underneath the tongue? Perfect. And then I'm gonna look at the upper roof of your mouth. All right. No signs of cleft palate. You would palpate the hard and soft palate, most common in children, infants and babies, a cleft palate. You would check the hard palate by palpating closest to you, and then soft palate is behind. And then looked at the tongue, looked at the buccal mucosa. All right. And then for gag reflex, you would use a tongue depressor and press down and check the gag reflex that way. Perfect. So that is your head. We're gonna go on to your lymph nodes. We'll check. Let me know if at any point anything hurts. We're gonna do pre-auricle, post-auricle, occipital, tonsillar, submandibular, submental, and then we'll do superficial, superficial anterior clavicular, or cervical, sorry. And then could you look left and right for me? So this is deep cervical, and the other way, deep cervical, and then posterior cervical, and then down here would be the supraclavicular. So that's all of the lymph nodes. All right. We're gonna go on to the neck. Looking at the neck, I don't see any signs of jugular vein distension, no bulging, no masses or anything. Nothing wrong with the carotid arteries. I will palpate each carotid artery. Perfect, one at a time. And then I will listen one at a time. Don't need you passing out. Looking for any bruits. Perfect. And none. All right, and then I will palpate to make sure there's nothing, no masses and deviations. Perfect. All right, so now we're gonna go on to respiratory. So I'm gonna listen for all of your lung sounds. Would you be able to take off your shirt for me for this part of the assessment?
Yes.
Cold. I know. My hands are cold too. Oh, before we get into the respiratory assessment, I'm going to real quick do the olfactory sense. I'm going to have you close your eyes and plug one nose. Are you able to sniff?
Yes.
And then other side, are you able to smell?
Yes.
Perfect. And before you open your eyes, what did you smell? Perfect. You can open your eyes. All right. The nose is done. Respiratory. When I took her respirations, there was no deviation of rate, rhythm, effort, use of accessory muscles, or retractions. My hands are cold. Okay, looking, I don't see any of that. We'll go into palpating is for the carotid, so I'm going to go ahead and listen to the 10 lung sounds, and then the 12 in the back, and then the 6 on the side.
I know it's gonna tickle.
Sorry. Using the diaphragm. Okay, I'm gonna have you breathe in, breathe out, breathe in. Perfect. And then breathe in, breathe in.
Sorry.
You're good. 1, 2, 5. Breathe in. And breathe in. And then I'm going to go under. Breathe in. And breathe in. 5, 6, 7, 8. And then one more. Perfect. All right. I'm going to do the 12 on the side. Would you be able to move on the side and then turn around? And then, so you can see, I'll do 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay. So 1. Okay. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Perfect. And then we're going to do the 6 on the side. So can you lift up your arms? The 1. And then I have to go bilateral. 2, 3, 4, 5, and 6. Sorry, almost done. Okay, so you can face forward. We looked at your posture already. Tactile fermentus and chest excursion. Can you turn around one more time? I'm so sorry. We're gonna go ahead and do a chest excursion. Deep breath in and out. All right. So my hands would have moved in and out with her. I'll do tactile fermentus. So every time I touch you, can you say 99?
99, 99, 99.
Perfect. All right. Now you can turn around and put your shirt on. So that was all 4 respirations. Now we're going to go on to, I need your shirt back off. I'm sorry. For the cardiovascular assessment, I'm going to be listening to your heart and all of your assay and nodes and whatnot. So, I'm going to first inspect so I don't see any heaves, lifts, wounds, scars, lesions, bruises, anything of that nature. So I'm going to palpate one of my hands again, your chest for any heaves, lifts, and lesions. I don't feel any like bulges or anything.
Nice and cold.
I know. All right, well, hurry up and get this part done. Okay, so you can get your shirt back on. So first, listening with the diaphragm, I'm going to do, oh my goodness, aortic, pulmonic, herbs, tricuspid, and mitral. And then I'll do the mitral for 1 minute there once I'm done. All right. Okay, pulmonic. Perfect. Herbs. Very good. Love doves. And then tricuspid. And then mitral. We're going to listen for 1 minute. Halfway there. All right, I got rate and rhythm were strong, and it was a pulse of 64. The S1 is best sound or best heard at the mitral valve, mid-clavicular mitral valve, and then S2 is best heard at the pulmonic um, region. Okay, so I'm gonna go ahead and do the pulses, your temporal. Strong. I'll do carotid one at a time. Oh no, not carotid, sorry. I already did carotid. So temporal, brachial, strong, strong, radial, strong and strong. I'm gonna come behind you and get your popliteal. This one's always fun to find. Okay, popliteal. Posterior tibialis. And then dorsal pedis. Strong and strong. Perfect. All right, so that's all of the pulses. Strong. We'll do the abdominal assessment, and then you can put your shirt back on. Sorry, and then I'm gonna get them all nice and cold again. Okay.
Don't worry.
Okay, so while I am getting my hands nice and warm, I'm inspecting her abdomen for size, color, contour, lesions, masses, bulges, striae, hair distribution, movement, size. Did I say size, shape, or not shape? Size, color, contour, size, color, contour, masses, lesions, scars, striae, hair distribution, and movement. Okay, so now I've inspected. Now I have to auscultate within the diaphragm. So I'm going to use the diaphragm for right lower quadrant and do all the quadrants clockwise, and then I'll do the bell with the aortic, renal, and iliac. So I have, move a little bit over here. Okay, so right lower quadrant, active, right upper, active, left upper, active, and then left lower, active. And then I'll switch to my bell for renal. Looking for any signs of Bruits, aortic. This is aortic, renal, and then iliac. And then the femoral would be right here, but we're not going to do that today. All normal, all active times 4. You can go ahead and, I'm going to go ahead and palpate. So let me know if you have any signs of pain or tenderness. Then I'll look at your face to make sure you're not lying. Any pain? No. All right. Perfect. All right. Now you can put your shirt back on. Get nice and warm. Okay. So now we're going to move on to the musculoskeletal. Okay, we're first going to do all of the joints and then do all the muscles. For all the muscles, we're looking for size, shape, and symmetry. 5 being normal, 4 being slight weakness, 3 being weakness, 2 being poor range of motion, 1 being severe weakness, and then 0 being paralysis. So first I'm going to have you open and close your mouth. Perfect, and close. And then I'm going to go ahead and open and close. Perfect. And then we'll do the next joint, which is your cervical spine. So we'll have you go flex, extend, and then right and left, and then ear to shoulder, ear to shoulder. And then I'll have you do all of that while I press on your cervical spine. So flex, extend, right and left, and then ear to shoulder, ear to shoulder. Perfect. And then there's no pain with that. Yeah. Perfect. We'll do shoulders. So first we're gonna do extend, extend, and then we'll do abduction, adduction, abduction, abduction, and then above your head. And then we'll make like a goalie sign, and then we'll do internal rotation, external rotation. That'll be all for the shoulders. So I'll have you do all of that while I palpate. So I'm gonna have you move forward, move back, and then do abduction out and in, and then abduction, abduction, and then up like a goalie, internal rotation, and then close that goalie. Let me do that one more time just so I can feel it. Perfect. All right, so then we're going to move on to your elbows. I'll have you go like this. This will be flex, extend, supination, pronation. I'll have you do all of that. So flex, extend, supination, pronation. Perfect. Yep, you're good. Supination. Then we'll do wrist. I'll have you do flex, extend, and then rotate. flex, extend, and then rotate. Perfect. A little clicky, but that's all right. And then for fingers, I'll have you make a fist, and then outward, and then abduct and adduct. And then I'll have you do that again. So fist, extend, abduct, and adduct. All right. So that's your wrist. I'll have you do fingers for strength. Those were the joints. I'm gonna do strength right now just so I don't forget. I'll have you do wrist strength. So I'll have you go forward and back. Oh, yep, forward and then back. And then I'll have you go against my fingers for finger strength. Perfect. That's wrist, fingers, and then hand grips. I'll have you squeeze. Perfect. Strong. All right, I'm gonna have you stand up for this and make sure that see. All right, perfect. So I'll have you do for the hips. I'll have you do abduct, adduct on both sides, and then no, for joints, I'll have you flex, extend, left and right, and then rotate. Okay, so if you could flex, go move forward, extend, and then left and right, and then rotate. Perfect. That was my knee. That's your own hip instead of just okay. So that's hips, and then we'll do the abduct, adduct, and then I'll have you do extend, extend, and then rotate. So on both sides, abduct, adduct, abduct, adduct, and then extend, extend backwards, and then kick you. Now you're fine. And then rotate, rotate. Okay, and then you can do the other side. So extend, extend, and then rotate. Perfect. All right, you can go ahead and sit down. Okay, I'm gonna have you do your knees. So I'm gonna have you put your knees up towards you. All right, yep. And on the other one, and then down, and then extend outward. Perfect. So up towards you, and then extend, and then extend. Perfect. All right, so then we're gonna do ankles. I'll have you do dorsiflexion, so moving up, and then plantar flexion moving down, and then inversion, and then eversion. Perfect. So dorsiflexion, and then plantar flexion, inversion, and then eversion. Perfect. All right. So now we'll do the muscle part of it. So I'll have you first do the. Ooh, sorry. I'll move this as I go. So the not sternum. Yeah, sternocleidomastoid. I'll have you push up against my hand, but I want you to go left and right first. All right, now push up against go one way first. Now push up against my hand, and then go left, and then push up against my hand. Perfect. And then we'll do trapezius, and shrug up and down, and then shrug and down, and then we'll do deltoids. You're right here, so then I'll have you go like this, and then push up. Perfect. And then push up. Perfect. Okay. We'll do bicep and tricep. So I'll have you curl and then go down. I'll have you curl one more time and then go down. Perfect. Okay. And then we'll do quads and hamstrings. We'll move out and then in. You want to move out like, yep, and then back in. Okay, so then I'll have you go out and then back in. Perfect. And I'm sure I already did the wrist and everything. And that's all for the muscles. I'll have you walk down 10 steps and back 10 steps. So gait is normal, straight, no signs of needing assistance. I'll have you do the Romberg test now. So I'll have you have your eyes open for 30 seconds.
Wait, open or closed?
Yeah, open.
Okay, open.
For 30 seconds. And then close for 30 seconds. All right. There's no signs of, okay, you're good. There's no signs of wavering. If I seen that she needed assistance, I would go over and make sure that she was safe. You can go ahead and sit down. Can you go ahead and close your eyes and then touch your nose with each finger, each pointed finger. Perfect. All right. So Romberg and the nose tests were perfect. Can you remember a blue slide for me?
Okay.
All right. So that concludes this assessment. I would report any deviations. I'm going to gather and cleanse all of my equipment. Her in a facility, bed is low and locked. Rails up per policy. Call light within reach, and then table within reach, and no trip hazards. Like I said, report any deviations, but report or document all of my findings in OneNote. Do you remember all three of those words?
Blue bed sock.
Perfect. And thank you. That concludes the assessment.